Hey, thanks for having me, Mike.
Yeah, you bet. Thanks for doing it. Can you tell me a little bit about your practice? Where do you operate as a family doctor?
Yeah, I've actually worked part-time as a family doctor in New Westminster. And just like many other family doctors, I have, quote-unquote, a side gig to help me work here. And I do rural locums out in Alberta, actually.
Oh, wow. Okay, that's very interesting. And what kind of changes have you seen as a family doctor in BC over the last few years?
Well, I think the biggest thing for me that I've noticed in my own practice is more and more of my own patients are asking if I can take on their family or friends because they're unable to find a family doctor, or their doctor retired and they couldn't find a replacement. So that, to me, actually adds a lot of distress because, I want to help as many people as I can, but obviously I can't be everybody's family doctor.
Right. So you have to, when you're asked that question, you have to give them the bad news and say, I'm not taking new patients?
Exactly. Yeah, exactly. Unfortunately. So
what kind of impact does it have on people when they don't have a family doctor? Like, I think about my own family. Like, we had a family doctor for a few years and then he moved away and there was no one to take his place. And we've been without one, like a lot of people in British Columbia ever since then. When people don't have that connection to a family doctor, what kind of impact does that have, would you say?
I mean, it's huge, right? I mean, family doctors are the face of the healthcare system for many patients that have a family doctor. We help figure out what types of tests they need, if they need to be seeing a specialist. And more importantly, too, a lot of preventative care is done by family doctors, screening for high blood pressure, heart disease, cancer diagnosis. All of those things wouldn't be able to happen if you didn't have a family doctor. So that's why it's vital that every British Columbian have access to a family doctor. And not to mention, too, it's a little bit hard to share your deepest, darkest secrets with a doctor you've only met one time and probably won't ever meet again through a walk-in clinic or urgent care or the emergency room. So being comfortable with somebody that you trust and know is really vital in providing the type of care that British Columbians deserve.
That's a really great point. You mentioned that you're a part-time family doctor. You've got a side gig there as well. Have you ever considered shutting down your family doctor practice? We keep hearing about clinics closing down, family doctors getting out of the business. Have you considered doing that yourself?
Yeah, it's definitely crossed my mind a few times. And the biggest issue is that, as a family doctor, and I can speak for many of my colleagues that feel the same way, is we as family doctors don't feel valued by the government and health authority in various ways. We're not being valued. And that is starting to enter a tipping point where, more and more things are happening that we're not feeling valued, and maybe we just need to be doing something else. And like Minister Dick said in your snippet there, that there are other opportunities for us as doctors trained in family medicine to work. Those opportunities are much more they're much more eye-opening. I mean, they're better paying and less responsibility. So, that's right now where our government, unfortunately, is valuing family doctors, is to work in situations where episodic care is given, like at urgent and primary care centers or in the hospital, and not really valuing the important work that we do as family doctors for British Columbians.
Speaking to Dr. Carlin Mann, family doctors for better patient care in BC, we hear a lot, too, about doctors facing burnout. Have you heard about that? Like, why is that happening? Are some family doctors burning out?
Yeah, no, I think that's part of the issue is as we find that our value is not being recognized by the government, we feel more and more burnout. I'm sure everybody would feel that, if the work you're doing isn't really being valued, that you're going to feel burnout. So I can kind of give you some examples if you'd like.
Sure. Yes, please.
Yeah, the first one is over the last few years, there's just been more and more administrative tasks downloaded onto us as family doctors, completing forms, needing to apply to the government to have our patients' medications covered, and the amount of paperwork is skyrocketing. Our fee-for-service system, which 90% of family doctors are paid through, hasn't changed for almost 30 years. We're still paid per visit. So if we spend 30 minutes with you or 30 seconds with you, we're paid the exact same amount. And that really needs to change to show us that the government values our time. And that time issue is probably the biggest reason why a lot of doctors are burning out. Some doctors are working almost the whole day, from 8 a.m. to 5 p.m. in clinic, seeing patients, then going home and charting and doing paperwork until 2 a.m. So it's just really not sustainable. So our government really needs to work harder to find ways to show that they value us more. And changing the fee-for-service system is one major role in that.
Could you, for people who are listening to this and they're hearing a doctor complain about, well, we're not valued enough, or maybe we're not making enough money, they may think, what? You're a doctor. You got to be kidding me. I thought doctors made a ton of money. Could you explain that? How does this fee-for-service model, why is it not working?
Yeah, I mean, it's not working because patients in BC want to spend time with their family doctors, and we as doctors do spend that time. Like I said, 30-second visit or a 30-minute visit, we're still paid the exact same amount, which works out to about $35. So, it makes it really tough to balance the needs of the clinic and paying your staff and obviously earning a reasonable salary with the needs of the financial pressures of the clinic. So what we need to do is have the government show us that they value us for the time that we're spending with patients, and change and modernize the fee-for-service system. And I'll just mention that, like I said, 90% of doctors are on fee-for-service in family medicine. And in 2020, we saw a drastic change in how we practice medicine by the introduction of telehealth fee-for-service codes. Overnight, we were able to do phone calls and video visits with our patients because of COVID-19. I mean, the same type of thinking could be applied here to really help support family doctors that are spending the time with patients but aren't being valued for it by the government through the visit-based fee-for-service system.
Yeah, sometimes when I talk about this issue, you get a kind of deja vu, because I remember a previous Liberal government, when the Liberals were in power, struggling with the same issue. And it's kind of like the tables just get turned. Sometimes the parties just change positions. And back then it was the NDP complaining to the Liberals. What about family doctors? Why is just this continuing? Why does this not, how come it doesn't get fixed? It just seems to go on and on and on. And do you think it could get worse, especially with the demographic bubble we're facing here with an aging population?
Yeah, I mean, that's my biggest fear right there, is because, our baby boomer populations, they're all getting older, of course, turning more than 65. And I was listening earlier to your Seniors Advocate on Simi show that, people over 65, 25% of them need a family doctor compared to maybe 1% younger than 65. So we're going to see a massive influx of people needing family doctors. I can't really speak to why family doctors haven't been valued for such a long time, but I think what we're hearing loud and clear now is that people want a family doctor. I think people know what value we bring to their healthcare and what we do to keep them healthy. And, everybody's getting older and worried that if you don't have a family doctor, what does that mean? I mean, we're seeing the effects of that now. People waiting 4, 5, 6, 7 hours outside an urgent and primary care center or emergency room just for a prescription refill. I mean, that's something a family doctor could easily do for you. So it is really concerning, and I'm glad more people in British Columbia are speaking out and speaking loudly.
Yeah, I mean, people going to an emergency room to get a prescription renewed is just obviously a misuse of the healthcare resources, right? You also mentioned, I've heard from family doctors who've told me that they have patients who may not have a family doctor now, who may be on the wrong meds, or if they're relying on walk-in clinics and going to a doctor they've never seen before, they might not know what medications they've been on before, and people might be on the wrong meds, or they're not on medications they should be on. Correct?
Yeah, exactly. I mean, that's the value in having a family doctor is, with my patients, I can remember or at least look up, what they were on 4, 5, 6 years ago. Whereas if you're visiting, multiple clinics or urgent cares or ER, that record is unfortunately not going to be available. So it does make it harder to manage somebody through episodic care, like the urgent and primary cares, versus having a family doctor. I mean, it makes sense to have a family doctor. There's been lots of studies shown that family doctors actually save the healthcare system money because we help prevent people from getting sicker and ending up in the ER. and being hospitalized. But yeah, it's definitely time for the government to realize that we provide a great value to the system, and obviously patients now are speaking out, which is great. Yeah. So.
Last question for you, Dr. Mann. You mentioned earlier that you're not taking new patients. I'm sure there's a lot of people listening saying, wow, I'd love it if this guy was my doctor. Like, for someone who is looking for a family doctor, do you have any tips on how they could maybe find one?
Yeah, that's a really tough question. I mean, I do know some communities have like a family doctor registry where you can sign up to be on a wait list for family doctors. But I think more than anything, I think they need to write to their MLAs and advocate that, there needs to be changes to the system to help us retain and recruit more family doctors. And I think the way to do that is to modernize our fee-for-service system immediately. If we implement time-based fee-for-service codes, I can tell you a lot of doctors and recent graduates, friends of mine, they would start a practice, but not in the current situation.
You mean, okay, does that mean, okay, if you have a longer appointment with a patient, you get paid more?
Yeah, exactly. Yeah. Okay. Yeah. If I spend 30 minutes with you explaining something that's more complex, or you've got 10 different problems that you want to deal with, and it takes 30 minutes, I'll be happy to do that all for you. And a lot of doctors do that already, but they're just taking a huge cut on what they're able to do in terms of office overhead and that sort of stuff. So
okay.
We just need to modernize our fee-for-service system. So.
Thank you for coming on today. I appreciate it a lot.
Thanks a lot, Mike. I really appreciate you bringing attention to this.
Let's go right to your phone calls on the shortage of family doctors. David in Surrey. Hi, David. Go ahead.
Hey, good morning. Thank you for taking my call. I just wanted to reflect what everyone else is probably experiencing with the short doctor visits. I actually left Richmond Doctor years ago because he was limiting us to 1 or 2 ailments per visit, and maybe 5 or 6 minutes, and then it was a rush to get you onto the next patient.
Yeah,
it does. I can see them being paid if they can justify how long they were with the patient. By all means, pay them for the 20 minutes. If it's a 2-minute visit, pay them for a 2-minute visit.
Right.
Just like any other business.
Yeah, right. Thank you for that. I think it's a great point. And I thought the guest brought that up as well. I mean, if you're coming in for like a 2-minute prescription renewal, why should you get paid the same as a more complicated visit? Thanks for that. Ed in Vancouver. Hi, Ed. Go ahead.
Yeah, thank you, Mike. Yeah, the suggestions from your doctor, however, I think would increase costs in the healthcare a lot.
Sure they would.
Yeah. So already they're very high and increasing over many years.
Yeah.
Yeah. So I don't know how that will work. And the second point is in countries like South Korea, I don't believe they have the family doctor system. And yet their health outcomes are as good, I think, as Canada's or better.
Okay. Thank you, Ed. Thank you for bottom lining it, because that's true. I mean, we're talking money here. We're talking money. We're talking big bucks. Roger in Vancouver. Hi, Roger. Go ahead.
Good morning, Mike. I think you remember, I think it was about 3 years ago that the Saudi Arabians got upset about some remarks that we made, and they withdrew 1,000 medical students from Canada.
Yes.
My problem is, why are we training all these offshore people to be in the medical thing when they go back to their country to practice? We all know it's about financing because they pay a lot more money to be in school than our Canadian students do. I think that's a thing that has to stop. Thank
you for that. I guess it works the other way too, right? Maybe we should be getting more foreign doctors into Canada. Tom in Surrey. Hey, Tom, you got 30 seconds. Go ahead.
Hey, great thing. Hey, there's no doubt this is going to cost the system more money, but it's not a good use of money to be waiting in 2 hours in an ER for a prescription renewal. Hey, I got a good buddy who's a doctor. He says they were never trained to be business people at school. He's got to see 4 to 5 people per hour in his office. He gets no pension, and that's just to cover his costs. He's always worried he doesn't have enough time to actually see these people because they have complicated problems, but he's got to get the people through to cover his costs. He says he deals with this psychological dilemma every day. So we got to think big picture here.